Hey guys, I'm so glad to see y'all. All right, Texas is in the house. Texas girl, I just got your message. Let me scroll up to the top. My guest just sent me a message. She's supposed to be here at 8:30, but she said her son's baseball game is going over. But I wanted to say I came on at 8:15 because I wanted to see you all. Say hey, tell you what's going on. Grizz is in the house. Melissa, Crystal, my Texas girl, Lisa, um, Tracy, Amy. Let's see, Mike Essery. Mike, I know you said you're awesome. That's so sweet. Thank you. Oh no matter. Are you Rhonda? You must be Rhonda. Let's see. Olivia's here. Olivia, I haven't seen you in a while. Oh, Ray, you know you can't be here because I'm scared of you. And Jill. And D. Here, D. Let me make you a moderator. Ah, I don't know what they just said, but okay. Let's see. D, I'm trying to make you a moderator and it keeps just pulling up put user in timeout or blocker. I don't want to block you. I'm trying to make you a mod. Hold on. Let me try it under a different one. Jill Moser. Oh my gosh, Shelly. It's so good to see you all. And somebody, hold on, let me see who's texting my phone. Oh, no worries. She said she might have to do her, start her interview from the car. I said that's fine. I'm okay. Oh my goodness. Okay, I'm going to try you again, D. I don't know why it won't let me add you as a moderator. No, it's not letting me add anyone. Ugh. I'm hitting my three little buttons. I don't want to bore you all, but I kind of wanted to tell you all what's going on. I want to tell you about the guest and where I've been. Well, you know where I've been. I've been in chats, but I haven't been on here for a long time. Let's see. Hybrid said Steph looks hot tonight. Why, thank you. Thank you so much. Red Dragon's here. Vince is here. We got all kinds of people. And D, I'm trying to add you, girl. Thank you, Texas girl. Shelly, of course, we're going to trees. There's a story. We all know that most of y'all from the Delphi case that know that that's most of us are here for that because that's how we met. Some of you are coming from the other communities that I've been in. How I ended up in YouTube was Chris Watts. So you guys are so sweet by saying the sweetest things. Thank you, Hybrid. And Randy's here. Randy, can I just say that I'm so grateful that you went on and did a little live telling everybody that I was going live. That was so sweet. I appreciate it. Grizz is in the house. Tragedy Pimps. Okay, cool. Thank you, Tragedy Pimps. Let's see. D, all I want to do is add you as a mod. That's all I want to do. I mean, is that so bad? Oh my gosh, there's a legend in here. Sluice in the house. Okay, I'm going to try again. Okay, I give up. Why can't I just add you? It won't let me add anybody after that. That's so weird. Okay, so anyway, so my guest. So I'm having Nurse D and Mr. Lou. Nurse D is a colleague / friend of mine, and she worked in a hospital for the criminally insane. She's brilliantly smart, so she's going to come from the nursing perspective. Well, she's going to give us the lowdown on how the whole thing works with when people say they're, actually, insane and they don't, or they're incompetent to stand trial. And what gave me the idea to contact her. Hey, Purdue, let me see if it'll let me add Purdue. Okay, y'all, anybody tell me why that I can't add anybody as a mod when I do the 3 lines? It's like only let me block people or put them in timeout. Anybody in here that could tell me that? Copper Horse, thank you, and thank you for dropping my link. Kelt's here, right? I'm scared of Ray though. Cindy's here. GP's here. We got all kinds of people in the house. I'm not sure why it's not letting me. Anybody in here that can tell me why I can't add anybody? I'm hitting the thumbs up. What? Okay, you're all good at hitting the thumbs up. Thank you for all. Oh, Texas, I thought you said I was doing that. Okay. Can anybody tell me why? Alex is here. Alex, I didn't even get it. I hadn't even talked to you. I'm so glad you came. I am grateful. Alex is, I consider a dear friend. She's one of the first lives I went on when I was talking about, she had a special, she's got a channel and she's awesome. And I would love to drop links. The problem is I can't add anybody as a moderator. I don't know why. Alex, can you tell me why I cannot get anybody to add in StreamYard? Do I need to be in YouTube? Is that why I can't add? Because if that is it, I'm gonna smile and be like, Stephanie, what? Thank you, Deb. That's so sweet. If I have to be in YouTube and this whole time. Hi, Michelle O. Okay, let's see. Oh my gosh, now I'm doubling up. And that's what it is. I know it. That's what it was. Oh my gosh. Oh, Alex, you already have a wrench from before. Okay. Jinx, do you mind dropping links and making you a moderator? Because you're so good at it. Okay. Now I can go and add people. All right. You guys are probably like, this girl didn't know what she's doing. And actually, you're right. She's not. I'm not. Okay. So anyway, where was I? Was I back on explaining how I met her? Purdue, add as a moderator. If you can drop links to our people, Sleuth, Sunny, Deb. Deb, did I add you yet? And Woofy's here. Oh, wait, I know what I was saying. This is the ADD in me. Okay, so Alex Erickson has a channel and she does excellent work. And she, there it did it again. Awesome. So Alex has a channel and she was doing a special on addiction. And I used to work as a nurse in a drug rehab. And so I went on her channel and was discussing from a point of view from the nurse's point of view on her channel. And then she has the lovely Woofy that is in chat. And Woofy, I'm her favorite, right, Woofy? It should say Woofy loves Steffa. Just kidding. But Woofy is an amazing person. And I met her through Alex. And they're just really great people. And I would highly recommend going to Alex's channel because she does great coverage like every day of cases. So, and she does lots of cases. And Summer Wells, I think that is how I first started talking to Alex, was maybe through Summer Wells. Okay, I don't want to make sure I don't miss anybody. I know I did. Woofy loves Steffa. Thank you, Woofy. And Callie's here. Hi, Callie. I'm sorry if I'm missing comments because, I'm a little bit on the slow side. Okay. And Lynn is here. And yes, Alex is awesome. Alex is a woman and she's gorgeous. Oh my gosh, she's absolutely gorgeous. Okay. So back to my guest. So Nurse D is a colleague of mine. And so I knew that she had worked in the hospital for the criminally insane, and the everything came out. Remember, obviously, you remember that everything came out about Richard Allen's attorneys saying that he was in psychosis, which is definitely a possibility. But then they said the word schizophrenia. And I actually have the document up here. I was going to wait till she got here just before I pulled up the document that the attorneys, the motion that they had filed. And I was a little bit hesitant to ask her because I know, from as a colleague. And she said she'll be here in 10 minutes. Okay, let me just let her know that's fine. So I was a little nervous to ask her if she would come on and talk about it, because remember when we saw that, it was a big to do. And I remember Deb and I were on Sunny's channel, and I was all up in arms about if this is true, if he's really in psychosis, he could be deemed incompetent. We'd never have a trial. So I was all up in arms about it, and I was all let my girl emotion stuff come out. And so I waited like a week after it came out, and it took some time. Hi, Polygraph. It took some time for us to match up our schedules, because she has a kid going to college. She's got one, like I said, her son's in baseball game. So we finally were able to work out tonight. Well, at that time, I did not know that her husband still works there. He's not a nurse, but he is a nursing assistant, and he does like the groups, and he works one-on-one with them. So she's having him on, and she said he likes to do a lot of talking. So I think that he'll be a lot of fun to have on here too. And she said he has a really good sense to tell. He works in a unit when they get them from the jail, and for the ones that come in that are pretending to be insane or incompetent to stand trial, and he has like a sense for that. So I think he'll be really good to ask questions. So when she gets on here, I'm going to have her, give you, her credentials, and explain where she came from nursing, and how she ended up at the hospital. She also worked in the jail, I think, for a short period of time, and how the process works from how the jail says, hey, we got a problem with this one, or what the lawyers comes in and says, hey, hi, Phil. Comes in and says, our, like, Richard Allen's attorneys came in and said, he's having schizophrenia, which I'm not a doctor. I can't do any diagnosis, but schizophrenia doesn't usually happen in your 50s. I think I can't say what they meant, but usually I might have been symptoms, or maybe not, I don't know, but it's not uncommon for somebody that is being stuck in a jail cell alone for 5 months to have psychosis. That's not unusual. So, thank you, Jinx. You put my Cash App up there. I've never had a Cash App, but you found my Cash App. Thank you. That was so sweet. So I just think it'll be really interesting for us to get that perspective, because we haven't had that perspective. We've had law enforcement's perspective. We've, oh my gosh, Perplex came in. I am nervous. You can tell I'm talking fast. Thank you, Purdue. So I guess I should have brought wine, but I have Pepsi. But I think it'll be really interesting to hear how they do the assessments on them to find out if they are, truly criminally insane. She was telling me their sentences can be different, and I'll let her explain that. That was really interesting. If they truly are criminally insane, their sentences can be different. So the punishment can be different. And I didn't know this. They actually share rooms in the criminally insane hospital. Can you imagine knowing that you're sleeping next to a serial killer? I can't imagine it. I was really shocked by that. I guess I just assumed everybody had their own room because that's what I've seen on TV. And I've never seen anybody. I've never been to a criminally insane hospital, to be honest. That's not something we did in nursing school, but I think it would have been very interesting. I find it fascinating. So, thanks, you guys. Thank you for being so sweet. What'd you say? I know a few YouTubers that are criminally insane. I think I know some that you might be talking about. So, let's see here. Hi, Roshide. You came. Rose, do you remember me telling you that I was going to have this nurse that worked in the criminally insane hospital? And I told you like almost a month ago, and it's taken so long for me to get her on. Mike said, "You sound great. Take a deep breath. Like a boss." I used to be the boss, but not anymore. Just a peon. Don't forget to hit the like button and subscribe. Yes, if you haven't subscribed, I would really appreciate it. I am not monetized. I work a real job at as a nurse, and Nurse D. I'm trying to keep her incognito. Nurse D is a colleague of mine and a friend. So, and if you are just now coming in, oh, my sister's here. Hi, Missy. Missy's gorgeous. And those of you that have been on the walk, there's my girl, Sunny's in the house. And after we're done with this, we're going to go to Sunny's channel because she has a live right at 9:30. Sunny, I don't know if we're going to be done at 9:30 because my guest is running a couple minutes late. Let me get to YouTube so I can add you as a moderator. Hold on. Or maybe you already are a moderator. No, because you would have showed up. Okay. And Sunny, if you can drop your own channel, that would be awesome. So everybody knows where to come for your live afterwards. So my sister, Missy, okay, let me tell this quick story because we're waiting anyway. And sis, I know you, I hope you're still here. But anyway, so Missy doesn't know anything about Delphi, right? So I decide, I think it'll be a good idea to take her to Delphi Walk and let her, learn about it on the way. So I try to explain Delphi in the 4-hour drive on the way there. And sis, no, I'm not going to say anything bad. I'm just telling the story. So we're driving there, and I try to print out the timeline, like from on the thing. Like, here, read this quick story of Delphi, and then you'll be all caught up. So when we go on the walk, you'll know the story, right? Like, she's going to learn it all from reading the timeline. But I was trying to do the best that I could at the time. So we go and stay, what, by the way, sis, I found out where we stayed. We stayed in Logansport. I guess that's a high meth area. So I apologize that I got us a hotel in a high meth area. I didn't know that. Okay. Anyway, so we go to the walk, and we get there, and it's like snowing. It's so cold. And I hope it's okay, sis, I'm saying this because I share everything. She just had a hysterectomy like 2 weeks before, so I have her on this walk. Yeah, we're still alive, so that's a plus. So this is when I decide we go down to the walk, we get to the bridge. And I'm like, there's Frank. Frank's coming into the story. Okay, hold on, Frank. Let me add you as a mod. You're late, sir. Sir, you're late. Hold on. Okay, so we get to the bridge. And I'm like, sis, I think I want to go down to the crime scene. And she says, I can't go down with you because I just had a hysterectomy, so I can't be going up and down hills. And I'm like, it's okay. I know you don't know these people, and we are at a crime area where 2 girls were murdered. But these people that you're around, they're real nice people, and I know them from the internet. So it's going to be okay, but I'll be back because I want to go down to the crime scene. Well, I never met Frank or any of these other people before. I just wanted to go to the crime scene, so I thought I was going to go by myself. So Frank and I think there was 4 other people followed me. Thank God. This is how I met Frank, because he became my hero, because I couldn't get down Ron Logan's property or back up Ron Logan's property. So this is what Frank did to me. They wanted to go back up to the through the cemetery because they wanted to see if that's how Bridge Guy had gotten back. We didn't know Richard. There was no Richard Allen even in the mix at this point. And they want to go see if that's how Bridge Guy went through, was through the cemetery. Well, my sister is back on the other side, where we came from, sitting at the bridge, and she doesn't know anybody. So I can't go all the way over to the cemetery because I just left her with people she doesn't even know. So here we are. So Frank and everybody else goes to the cemetery, and I am stuck going by myself, walking back to the bridge, and I get there, there's nobody there. So it's already freaky because, we are where we are, and we all know how we feel about Libby and Abby's case. So I had to walk the trail alone back to the cars, hoping that my sister is okay. But I knew she was okay because I knew she was with Marv and Vid Inquiries and other people, Randy. But now I'm scared because I had to walk the trail alone by myself in the cold. But anyway, everybody lived. Let me see if she has popped on yet. No. So that was my story with my sister. And Frank is left me alone. So now that you all know that Frank leaves women alone out in the middle of Delphi. So you guys all know that about Frank. So you can give him some crap about it. And my sister made it safely. I was the one that got left. Just kidding. I mean, it happened, but I forgive him. That's okay, Texas girl. Let's see. Dee's in here. She's great at doing links. And everybody that is in here, if I missed any creators that I did not add as a mod, I apologize because I want you guys to be able to drop your own links. And Jinx is dropping them as well. Sleuth, I don't know if you're still in here. So I can drop your link. And Night Shadow, let me welcome you. I didn't see you here. Or Adrian. You're going back to work, Adrian. Okay. And I'm just trying to pass time until she gets to her car. Let's see. Thank you, No Bad Beads. You are the first person that ever sent me a Cash App in my life. Thank you. Ever. I've never had a Cash App. I'm always the one sending them, like to my kid. Okay. And Amy Fountain is my new best friend, by the way. I met her through Texas Girl. AJ Miller, support with Steffa. Don't be crass. Don't be an ass, or your ass is grass. I'm not usually an ass. I'm usually the nice one in the group. But thank you, I guess. If you're a troll, I just want you to know you're my first troll. So I thank you for that. Sis will be sisters. Do you know Missy and I are not biological sisters, but we have a story. Nomad Beats, I really do appreciate that. Was very sweet of you. Oh, that's Rhonda. Duh. I just met Rhonda in just Discord, like, I don't know, when we got on here at 8:15. Ellen, thank you, Ellen, for being with us too. Zero tolerance for trolls. Hey, Jinx, I feel honored because I've never had a troll before. So that means I might be starting to make it in the YouTube world. Actually, I'm not trying to make it in the YouTube world. Thank you, Deb. I'm not always a doll. I mean, I probably 99% of the time. Just kidding. My daughter would disagree with me. I'm just waiting for, oh, they're here. Okay. Nurse D, are you there?
I'm here.
Yay! And is Mr. Lou with you?
Yep, he's joining right now.
Wonderful. I'm so excited. Is he going to be with you on your phone, or is he going to be on his own phone?
No, he's on my phone with me.
Okay. Everybody, you've been waiting to finally meet Nurse D and Mr. Lou. Everybody's really excited to hear about your endeavors and your about working in the hospital for the criminally insane. And I let them know that your husband still works there. And Mr. Lou, are you there?
Yes, I am. How you doing?
I'm good. How are you?
Good.
I'm so excited to meet you. I feel like I know you. I know
likewise.
Nurse D, would you like to tell us a little bit about your credentials, where you started? Just start from birth.
That might be a long story, but I apologize for the delay. We're just
no
getting home, so I apologize. So I am Nurse D. I'm actually a registered nurse. I have my bachelor's in nursing. I actually have been a nurse, I think, going on 15 years now. Once I graduated from nursing school, I did about 6 months on the med surg unit. And then I actually, at that point, I knew that I wanted to move into the behavioral health world. But at that time in nursing, you kind of had to get your 6 months of med surg experience before you transition to a specialized field. So after I got my 6 months, I actually transitioned immediately over to the state psychiatric hospital, where I worked for almost 8 years. And then I actually transitioned into the role that I am in now, which is a behavioral health role. So during that time, working at the state psychiatric hospital, I worked on actually all the different units. We had, back at that time when I worked at the hospital, they had what we called 3 forensic units that housed, of course, those that were not guilty by reason of insanity or that were coming to the hospital for competency evaluations. And then we also had 2 what we called civil units. And those units are for patients that are actually coming to us from either a private psychiatric hospital or usually from jail. And then I did leave the state hospital for a very short time. I did work at a correctional facility for about a year. And then after that time, I did go back to the state psychiatric hospital. Do you want me to take any questions now, or do you want to ask me anything before I introduce Mr. Lou?
Why don't you go ahead and Mr. Liu? We are excited to have you and welcome.
Well,
So let's hear about Mr. Liu, and let's at the end we'll ask questions. Um, I have lots of questions, and I'm sure they do too. But let's go ahead and learn about Mr. Liu.
yeah, I've been at the state hospital for 15 years now. I've been a mental health tech. They call us therapeutic program workers, but we're basically just mental health techs. I've been, like I said, I've been there 15 years. I've worked on mainly the forensic units, but for the last few years, I've been on the civil side, which the difference is the forensic units are all the people that are sentenced already through the court system, and they're there to do their time as like a prison sentence, except they do it in a psychiatric setting because they're deemed not guilty by reason of insanity. I've been on all the shifts there. I've been in like all female patients, male patients, from all different kinds of levels of illness, from people that are severely ill with paranoid schizophrenia to people that just have bipolar disorder. There's a wide range of patients there, and I thoroughly enjoy the job, and I plan on retiring from there.
That's awesome. That's awesome. So you really enjoy it.
Yeah, I do. I work a lot of overtime, so it's a good job.
Yes, I know you work a lot of overtime because Nurse D and I tried to connect all of us
Yeah,
together, and you work a lot.
yeah. It's a very easy job physically. It's just it can be mentally tough at times, but physically the workload is very minimal. So it's not nearly as bad as it sounds when you say state psychiatric hospital. People think that it's a really tough, rough environment, which it can be from time to time, but most days there are very routine and very uneventful days. They're pretty routine, but it's a good place to work, and I really enjoy the population, because they truly are the forgotten population in this country. And they a lot of them people, they don't have families or friends or really anybody that really cares about them. So the staff at the hospital are basically their only connection to the outside world. So we become almost like family members to a lot of the patients there, because a lot of them are sentenced there for years and decades. So we're kind of really the only lifeline they have. So
Oh,
we become pretty close with a lot of patients there. It's kind of weird, but that's just the reality of it.
have you noticed that they have their family is involved in when they first get there, and then they stop coming around, or the family's not really involved?
It varies. A lot of people with mental illness, unfortunately, burn a lot of bridges throughout their young adulthood and 20s and 30s, because their symptoms get in the way of their recovery. And I think families try to help for a long time, but a lot of times they end up just kind of giving up, because the reality of schizophrenia is a very tough road. It's a very, very, very tough road for most people with schizophrenia. I mean, for every person that functions in society with schizophrenia, there's dozens and dozens that just constantly have relapses. They get arrested.
Sorry, he threw the phone over to me so he could take control of the dogs.
That's okay. Mine just happens to be quiet right now. So we, how we this week, for those of you that are just getting here, some you may have already heard me say that I keep having to remember Nurse D. I in Nurse D, you weren't here when I was talking about it. When the Richard Allen, and I sent this to you. Did you end up seeing that PDF?
Yes, I reviewed that. Yeah.
Okay. So, and for everybody in chat, I know that we are like, most of us are Delphi. We know a lot of it inside and out, and we have all these different opinions. And but Miss Nurse D is just doesn't know the case. So she when I it took me about a week to finally ask you, Nurse D, if you would do this, because I wasn't sure if it would be appropriate to ask you. But I was so interested in hearing your opinion when this came out, this motion from Richard Allen. And this isn't just about Richard Allen. This is generally speaking. We just had everybody, following true crime knows in here that we had Lori Vallow that's gone twice to the state hospital and deemed incompetent, I think, for 6 months each time. And then we all know that Gannon Stout's stepmother, I don't even like to say her name, she tried to pretend to have mental illness to be deemed incompetent as well. But there was something that you had said, and I think that this is really, people probably do not know this. I know I was shocked when you said it, that if somebody goes to or is actually deemed incompetent or not able to stand trial, you said their sentence can be different from being sentenced to prison to be sentenced to the mental hospital. Would you share a little bit about that with us?
Yeah, and so, I can't speak to like what research shows. I can speak to what I have seen at the state hospital, and what I have heard working between the prison and the state hospital. And historically, those that are deemed incompetent to stand trial or not guilty by reason of insanity, they actually serve a much greater time in a psychiatric hospital than they would ever serve in prison. So, I gave the example of somebody that commits murder. So, in the event that an individual is found not guilty by reason of insanity, we have seen individuals get life at the state psychiatric hospital compared to somebody that may only get 15 to 20 years in prison for the same offense. And then not only that, but if they go to prison, a lot of times some come out and they don't have to serve on parole, or, they're just free and clear after they get out of prison. But at the state psychiatric hospital, if you do get out, and those usually that, those that do get out, they get released on what they call a conditional release, and it is very strict. They, have caseworkers that they work with. They usually are discharged to group homes. They have to be med compliant. They have to check in with their doctors, and any behavior or any illegal activity immediately gets you sent back to the state hospital.
That to me was really shocking, because I wasn't expecting that. When you said that, I thought, wow. If anything, I thought it would be opposite.
Yeah. And I think a lot of people think that, and I think a lot of people have that misconception that, oh, if I am found guilty of this crime, I can, quote unquote, pretend that I am criminally insane and I just get this easy way out and I can go to the state hospital. And oftentimes that is not the case. Sometimes when they come to us, they don't want to stay with us because of the strict criteria that you have to meet, once you're discharged from the hospital. And that's all dependent on your crime and the length of sentence. And you do get sentenced to the state psychiatric hospital. So a lot goes into it, and so, yeah.
So you had told me there was a team, and I wrote it down. Let me put my glasses on so I can actually see. Okay, you had said, let me look for it. So you said let's see, there are people, a court diagnostic team
Mhm.
determines if it's necessary for them to go to a state hospital or if they can handle it in jail. Would
Mhm.
you explain that when we were having that conversation a little bit? Because that was
Sure.
very interesting.
Sure. So when an individual commits a crime, they generally get sentenced to jail or go to jail, and they go through their process. I don't know all the ins and outs of that. I just know they get sent to jail. And as they're going through all of their proceedings, court hearings, talking with their attorneys, whatever that legal process looks like, and somebody comes up and says, okay, this individual may be mentally ill. We need, maybe was mentally ill at the time, or hey, we already know this individual and we know that this individual is mentally ill. Um, or, maybe they're acting out in jail, or, starting to display some behaviors that they become concerned about. And so they have this agency, I think works with the jails and the legal system. It's called court diagnostics, and generally the individual will start there, and they have psychologists on staff that will do some evaluations, and that's those staff that work for the agency will say, okay, we want to send them to the state hospital for further evaluation, and monitoring, because that could take up, that agency will say, okay, we're going to send them to the state hospital for a period of 6 months or a year or 8 months or a month to undergo testing, get medicated if that is necessary, and let's see what happens with that individual. And then once they get to the hospital, that whole process starts.
So the diagnostic, do they do most of the diagnostic testing when they get to the hospital?
The court diagnostics will do kind of like baseline assessments, and that's when they kind of determine that something more is going on with that individual, and that is who generally will work with the hospital to ask for the evaluations from our forensic teams to continue the psychological testing of that individual.
So what kind of things would like, and I know this is not a black and white, there's a lot of gray areas
Mm-hmm.
that would constitute somebody actually coming to the state hospital or staying like in jail,
Mm-hmm.
or in prison if they're already been sentenced, because you'll get them from prison too if they start having behaviors, correct?
We do not get them from prison, no.
Okay.
Once We will only get them from the jail before they are sentenced.
Okay.
But if they end up in prison, we do not take care of those individuals at all. They do not come to the state hospital. These are only individuals that are have committed a crime and are facing prison time
Okay.
and dependent on the crime.
I see. Okay.
Mm-hmm.
So, what are they looking for? The psychiatrist, psychologist looking for where they say the jail is not going to be appropriate. This person needs to be in the state hospital.
Sure. So once they come to the state hospital, of course, nursing staff will do their initial assessment on the individual. So we're asking them all the basic questions of a nursing assessment, because we care about there and now. What do we have to do to help this individual as a nurse? And then once we do their initial assessment, and those are, do you take medications? What does your history look like? We're just gathering kind of that baseline, very generalized information if they're able to cooperate and answer those types of questions. And then once we do our assessment, usually within 24 hours, they have what we call treatment team. where the patient will be brought in front of the psychiatrist, the psychologist, recreation therapist, the nursing team, and they will undergo a psychiatric exam. So the psychiatrist is assessing their mental status, their behaviors, what's going on. If the patient can do that, we have to remember that some of our patients come in extremely psychotic, so we cannot gather this type of information. And so, we can travel down both those roads if you want me to, but and I can give you an example of each.
That would be great.
So, okay, so let me give you an example of somebody that is extremely psychotic. So I'm talking, extremely delusional, paranoid, aggressive, they're violent. And those individuals, we try to assess, we try to talk to them. We're monitoring their behavior. The psychiatrist will offer medications. If they refuse medications, we do have the capacity to intervene in what we call administering emergency medications by injection. And so those individuals we will continue to monitor. Some we're not allowed to medicate. The courts will say, we don't want this individual to have any medications because we want to see what their behavior is like.
Really?
We can still administer emergency medication in emergent situation, and those types of situations are usually because of aggression towards staff or other patients. So we can do that, but the psychiatrist may not always be able to offer oral medications right away. But that is usually dependent on what the courts tell us that we can do. So that is kind of the most extreme case, the most, I'm talking, paranoid, schizophrenic, delusional, they're violent, they're coming in spitting, and they're just very aggressive. We're going to monitor those patients. We're going to try to stabilize them. We're going to treat them, keep them safe. We have utilized restraints in the past, if we have to. And then we get those patients that are coming to us that we get them, they tell us they're mentally ill, we bring them to treatment team, and they're trying to persuade us that they're mentally ill, but they're able to recall events. They're able to give us a very definitive timeline of everything. Those patients are called, malingerers. I don't know. Though that is a malingerer is somebody that is trying basically to get out of their legal charges. A malingerer is somebody, and we've seen them all the time. My husband can probably give better examples than I can give because he's with them probably a lot more than I have. But those are the most difficult patients to work with. They are very manipulative. They try to, like I said, persuade the whole entire medical team that they're mentally ill. They were mentally ill at the time of the crime. They're really trying to give a picture
Superficial
of,
suicide attempt.
like he's saying, like superficial suicide. They're telling us that they want to kill themselves because they have nothing to live for because of the crime that they committed. But the staff at the state, like the psychiatric, they're very good at catching those individuals. So they do undergo the same kind of testing, as the most severe mentally ill patient, dependent on the crime that they've committed. So those are two of the patients. Of course, we see all kinds of patients, but just to kind of give you an example of what we can see. because I kind of know, like I said, I've read a little bit about the story of, Richard Allen, and it's, I'm kind of intrigued now by all the events that I've read about and his kind of stories. So, I of course I can't diagnose or cast judgment, but we see all kinds of different levels of mental illness, personality disorders, malingerers. And I can tell you that the staff, the psychiatrists, they're very good at their job. They're able to tell pretty quickly the level or severity of mental illness, and if the individual is just trying to essentially play the system. My husband's pointing at me that he kind of wants to talk. So.
Yeah, I'm excited because I know that he works for those that, well, let him explain because he actually works one-on-one with them in groups. And so I'll let him talk about that. And I heard that you're one person that can really, you have a knack for figuring these people out that are playing around.
Yeah, I mean, it's pretty obvious once you're there for a while. The people that want to be there typically are people that are facing a long time in prison, or have the really bad living arrangements. But the psychologist does like a couple tests for malingering with a lot of people. It's like 300 or 400 questions. It's like multiple choice. And then they score it, and then they send it out to the company, and it comes back, and it's like really accurate. And anybody that the psychiatrist or the psychologist that they think they're malingering, 95 times out of 100 they are, and the test quickly shows it. And then once they get the results of them tests and do a few other things, they usually send them back to jail pretty quickly, and they usually don't come back. So most of the time, if somebody's malingering, like my wife said, they find out pretty quickly, and they get them back to where they're supposed to be, which is the prison system. But once in a while, some of these people are really, really good at even tricking like the best psychologists and psychiatrists. There's some of these criminals are like highly, highly intelligent people. A lot of them aren't, but once in a while, I think a couple do slide through the cracks and are able to convince the mental health system that they are, mentally ill when they really probably aren't, but they're that crafty. Some of the individuals are.
And just because they're mentally ill, like we have so many in our country that are mentally ill, and we don't treat them properly at all.
No.
I can attest to that for what I went through with my daughter as I got her treatment starting at age 8. And if I wouldn't have advocated on her behalf, it would have been a nightmare. But just because they're mentally ill at the time doesn't mean
that's the thing with competency is like a lot of these people that come to the hospital for competency restorations, like during the time of the crime, they're not competent because they're off their medicine. They're cycling, whatever. They're not in a very good place mentally, but then they come to the hospital and they get put on medications for, a few months, and then they seem pretty competent. But that's where the competency thing is kind of weird, because a lot of the people at the time of the crime, they weren't competent, but they become competent, and then they have some more insight into what they did, and a lot of them have like remorse, because I've seen it so many times where people come into the hospital with very serious crimes, the very most serious crimes that you could possibly have, and they don't even really realize like what they did sometimes. And then after being on medicine for a short time, sometimes a few weeks, they start to gain some insight, and then they really go into kind of a depressed state. And a lot of them are really pretty good people, to be honest, when they're on medicine. Yeah. But they unfortunately, the reality of mental health is a lot of people quit taking their medicine, and it's they're different people off their medicine. They're completely different people. I mean, I've seen people come into the hospital, you can't even have a conversation with them. They're manic, they're pacing, they're just unkept, they're disheveled, and then they're on medicine and they're like they do a 360. You can sit down and you can have a rational conversation with them. They're highly intelligent. A lot of them are very smart individuals. So I've seen the effectiveness of psychiatric medications. I mean, they are great things for these people, because without them, they would not be able to function. And the downfall to the psychotropics is the side effects are very harsh, but these people's mental states are just, it's like night and day. I've seen it so many times now where people are just so bent out of shape, and then like I said, they can function back in society. Some of them can even go back to work and live a pretty normal life.
In those cases, would they, because they were not competent at the time of the crime, but now they're competent, would they be held liable for what they did at that time of the crime? Do you know
Yeah,
how that works?
Yeah, they can.
Yes.
So if so that what Mr. Lou's talking about is what they call competency, or restored to competency. So individuals can get sent to the hospital for a competency evaluation. And what the courts want to know is, can we restore them to competency so that they first recognize the crime that they committed, and are they competent to stand trial? Meaning, are they going to understand the court proceedings? Are they going to understand what is going on? And then if they can, at that point, they will go and face the trial, the jury, and everything. But we do have situations where they are found incompetent to stand trial. And they will not, most likely not regain competency. And then they are sentenced to the state hospital for a period of time.
Will do you ever have people that actually get out that have done like a murder, and then
I've seen, since I've been there, probably, I don't know, a handful, 5, 6 people maybe that have committed that crime that have gotten out. Now they're not completely free. They're in a group home or a less restrictive environment, another facility that's not a state hospital, but they're still in a restricted environment somewhat.
okay.
But yeah, they have. I have seen that a few times. Yes.
Yeah.
Okay.
But he's been there 15 years and he's only seen it a handful.
Yeah,
of times.
it doesn't happen a lot. And at where I work, there's 5 levels. That the people that are forensic, they have to go through the level system to get out, and it's level 1 through 5, and each level has to be granted through the courts, and each level takes months and sometimes years to get, depending on the person's crime severity of the crime. It can take a real long time, but every level they get has to be submitted, by the psychiatrist, the treatment team, through the courts, and then it has to be approved, and the forensic monitor outside, whoever, all the patients have a forensic monitor that's appointed to them, like in their county, and they have to approve it with the court. So every level is really, it's scrutinized and it's looked at very thoroughly before they grant it, and they grant each level one at a time. So it's a long process to get out there.
Somebody had asked in the chat, how long does the typical process take to get to competence? That I believe is going to be depending on.
Yes.
Yeah, it's very individualized.
Some are 90 days, some are 6 months, some are a year, whatever the court orders.
Mm-hmm.
My sweet little daughter is here. Hello, Brittany.
Hi.
I'm just talking about you, Brittany. Okay. There. I put on my glasses again. I wanted to ask Nurse D about medication. Mm-hmm. So, if I found out that the courts can mandate that they take medication.
Mm-hmm.
What does that look like if they're refusing oral medication? I mean, what does that look like if they're saying absolutely not? You're not putting it down. How do you put it down their throat? I mean,
we don't. We administer. So there have been plenty of patients that don't want to take medication. So the state psychiatric hospitals are the only facilities that are allowed to administer medications by force, meaning that if a patient refuses their medications, we actually call a team of staff. It usually involves at least probably 15-20 staff, plus the hospital has state police. So we call onto all of those individuals, and we usually, I'm not saying all the time, but usually with that show of force, that patient will cooperate and accept that um, injection, willfully, where we don't have to use any type of force. But if they see all those people, they remain aggressive and violent and fighting, we will use force. And usually that will involve a takedown of the patient.
Does that happen frequently, or is that like an infrequent?
Honestly, when I was there, it was probably some of the busiest times at the state hospital. It was happening all the time.
Wow.
I feel like, and again, I worked on the acute side, so we got some extremely psychotic individuals. But I feel like it slows down sometimes. It like comes in waves, I guess. You might feel like every day for days on end that you're, unfortunately having to use force on a patient. And then you might go 2, 3, 4 months and not have any episodes of that. Because once the individual knows, I mean, essentially they're not going to win because we're going to have to keep doing this, they will comply with taking oral medications eventually. So that does not go on forever with the same patient. I can tell you that it has happened where we've had to administer medications every day by force for well over a year. And that has only probably happened less than a handful of times, but it does happen, unfortunately.
Wow, that really surprises me. That's does the psychiatrist ever change and change it to like a monthly Haldol or?
Yeah, they do try that so that they're not getting those daily injections. And those types of situations usually occur in some of our most sickest patients. And they're just never going to gain any insight into their mental illness, unfortunately. That generally does not happen to those individuals that kind of pretending to be mentally ill because they don't want to keep taking those types of medications. But yeah, it can happen.
Wow, that's real. I never. I find it that fascinating that that somebody could fight for a whole year. So let me ask Mr. Liu, how do you, with your instinct, figure that a patient is playing around, that they're there to try to get out of having to take to prison or jail?
One thing that I always kind of stick to is when you ask somebody that's truly psychotic if they hear voices, they always say no. They always tell you no. So a lot of these people that are malingering, they try to really go overboard with telling the doctor and the staff that they're hearing voices, but none of their actions indicate that they're hearing voices. Because when somebody's hearing voices, you can tell they're very distracted, they're very guarded, their eyes are shifty, their mannerisms, you can just really tell. And somebody that's not hearing voices, that's saying they're hearing voices, and none of their actions support it. It's very obvious when you're around people with schizophrenia all the time. You can truly tell pretty easily people that have internal stimuli that are, reacting to their thoughts and their delusions. And when people voice that they are hearing, voices, a lot of times they're not. That's a very telltale sign to me, is that when people say they're hearing voices, they're not. So that's one thing that I've really noticed from my experience, is that people that are psychotic, they'll always deny hearing voices. They'll always deny it. But people that don't hear voices will always say they're hearing voices. That's one like giveaway to me.
I gotcha. Interesting. And then I kind of wanted to touch base on this, and I already know the answer, but I don't know if my chat is familiar with ECT. Mm-hmm. I had asked Nurse D if they did ECT at their facility, mm-hmm. And does anybody in the chat not know what ECT is? Electric shock therapy. I don't know. It used to be barbaric, but it's not now. Mm-hmm. So, one of you want to answer that question?
Sure. Yeah. I can tell you that the state psychiatric hospital does not do ECT treatment at the facility, just because generally ECT is administered under anesthetic, and that has to be done in a medical facility, generally speaking. And at the state psychiatric hospital, we only do very minimal medical care, meaning if the individual needs a lot of medical assistance, they are transferred out of the facility. So they may, and so again, with the state psychiatric hospital having some civil units, meaning individuals that have not been charged with crimes, they have recommended ECT, but usually it's after discharge. It's never occurred simultaneously while they're at the hospital. We try to stabilize them. The doctor may recommend it, and then we try to refer them out. But no, that does not occur at the state hospital.
Okay. And I know that is, people are going back and forth if it's good, it's bad. I just saw that it saved a couple patients that medication didn't work. So, mm-hmm. That's, I've seen it be good, but I know other people have seen it be bad. So
ECT has pros and cons, just like any medications, any treatment. It can, some people, it's just long term. They just don't know enough, I don't think, about ECT to understand it all. Mm-hmm. I have seen there's the biggest risk with ECT is amnesia. So they get very concerned about somebody with major depression and giving ECT treatments and causing increased confusion and amnesia. And that amnesia can last long term. So again, I have heard the effects can be good, but the risk is still there. I will mention this completely. Actually, I'm just learning about it, and I just heard about it, and you guys, can take the information and look it up. While we're on the topic of ECT, another treatment that is up and coming is ketamine treatment, which is very, it's still experimental, but I am hearing that it is showing some positive effects. So something to keep, in your mind and kind of research, which I'm doing now on it because I think it's interesting. But I thought I would call that out because that is actually being prescribed over ECT.
We just had a discussion about that, actually. The ketamine, I would love, maybe one day you can come on and we'll talk about ketamine. I've seen, the problem is that you have to pay out of pocket now because insurance doesn't cover it. But there's been so many people that seem to, from the documentaries that I've seen, and, documentaries can be um, one-sided, but it seems that ketamine people are getting help. People that were stuck in depression that were never able to come out of depression, they have these ketamine treatments, um, and seems to be working for them. So I would love to have a discussion sometime about ketamine. That's very interesting.
Mm-hmm.
Very interesting up and coming treatment.
Yeah, the only thing that a major con with ketamine treatment is the addictive quality in
Really.
of ketamine, and they actually have two different forms. One, it actually has been FDA approved and only in the use in individuals with major depressive episodes that are not responsive to other treatment, and it's nasally, and it's administered under psychiatric or psychiatrists. They keep very close eye on the administration of it. So yeah, I don't know enough about it. I'm just now kind of hearing about it, so I'm doing some research. And I recently talked to a physician that is actually starting to refer some of his patients, and less than a handful of patients that he has referred out, but he is seeing some very positive effects of prescribing the medication.
And they use it also for AOD, for a treatment of alcohol and drugs as well. I've heard people talk about. And I don't know if anybody. Well, I'm not. That's a whole nother subject. I'm not even going to go there. There was the medication I wanted to talk about. Let's see. Oh, I know what I wanted to ask. When a patient in on one of the forensic floors, what does a typical day look like for them? And this is probably Mr. Lou, because I know that you are probably one-on-one with them often. What does that look like for them?
Well, I mean, in reality, it's a lot like prison. We have 5 units at the hospital. Each unit contains 20 to 25 patients. It's an open unit. They have bedrooms, but it's an open day area with a TV area and a dining area. Their day consists of like I said, it's a lot like prison. They get up, they eat breakfast. A lot of them go back to bed after after breakfast. Some of them are in some like the work program where they have like their work level 3, which is the third level for the forensic patients, where they can actually work in the hospital under supervision for a couple hours a day, but only a handful of them are able to do that. So a lot of them spend a lot of time just sleeping, watching TV. We do have some groups. We have a few groups a day where the psychologist has a group and the social workers have a group. People in my position, we mainly just kind of monitor. We take them outside. Every unit has a patio area, so we're able to take them out and we can walk a little bit and play basketball, stuff like that. But it's more or less a prison setting with a little bit more freedoms, but not much. All the forensic patients there, well, the vast majority of them are like an all male units. They do have one co-ed forensic unit, but them are all like higher functioning individuals. So like I said, it's basically a prison setting with just a little bit more freedom and a little more maybe outside time than you would get at prison. But for the most part, it's a pretty routine, straightforward, pretty boring day for a lot of people, to be honest.
Gotcha. It's we don't get educated on what that looks like out. We have movies that really don't capture what it's really like. There was one thing that I found interesting. I don't know if you were on here yet. When yesterday, Nurse D had said that they share rooms. I would think that I would be terrified if I was sharing a room with a serial killer. So how does that work? How do they put two serial killers in one room? I mean, or
They, I've seen that, yes, where they've had two people with severe crimes in the same room. Normally, like if somebody comes in and they're very combative or highly psychotic, very unpredictable, they'll be in their own room for until they become, somewhat stable on medications. But no, they try to keep people, safe to. It's kind of hard. I mean, there's a tight line, for a lot of the things the doctors have to do there. But sometimes we have to like write it like a no roommate order to keep them separated. And we have a couple single rooms where we can put them, away from patients if need be. But usually the people that come to us, they're usually stable enough by the time they get to us, because a lot of times they'll be put on medicine like before they get to the hospital. So a lot of times they're not in really horrible condition by the time they get to us, because a lot of them have been like in the court system before they come to the hospital, and they're on medicine. Some of them have court appointed guardians that put them on medicine. So a lot of times people are semi-stable by the time they get to us.
Okay. I thought they would come to you, like you would be the worst of the worst first.
Well, a lot of the people, they can't come straight from the streets to the state hospital. They have to come from a jail. They have to come from another hospital, rescue crisis type places. That in Toledo, it's like Harbor and Zeph Center and Unison. So all the patients we get are from a different agency. So a lot of these other agencies, they put these people on medications before they get to us. So usually by the time they get to us, they're, not in horrible shape. Sometimes they still are, but a lot of times they're not doing too bad. They come in and they're very sedated or, half medicated, I should say. So by the time they get to us, a lot of them, they're not very combative.
Gotcha. That makes sense. So I'm going to look at, do you guys, am I holding you up? If you,
No.
Okay. I just wanted to make sure. I was looking at, the Richard Allen, why isn't my computer going? Hold on one second. There we go. Okay. I was looking at that motion, what they had said, about Mr. Allen, his attorneys. And I'm not sure if this is something that defense attorney is just saying. I know that you wouldn't know for nobody knows for sure. Mm-hmm. But I know that, okay, let me get, okay, Mr.'s concrete floor, let me find the part when they say, I didn't think it was that far down. Sorry guys, I just want to find this. I was going to ask you your thoughts on this one part of the emergency motion to modify safekeeping. Let's see. Now, Richard Allen, they had already taken him. They did not keep him in jail. They sent him to a prison, even though he has not been convicted, because the jail where he would have gone, they said they didn't feel like they could keep him safe, because this is like the biggest case that Indiana's ever had. Mm-hmm. So they sent him to this Westville Correctional facility, prison, and he's been in confinement for 5 months at this point when this happened. Mm-hmm. And you know that because I showed you that. Right. But I was trying to find the part, which I don't know why my computer keeps beeping. Let's see. This is said steep decline. Okay, here it is. Alan was a different version than counsel for Mr. Allen had interacted with over the past 5 months. Mr. Allen appeared to be suffering from various psychotic symptoms, which counsel would describe as schizophrenic and delusional. Counsel further believes that Mr. Allen seems to be suffering from memory loss and demonstrating an overall inability to communicate rationally with counsel and family members. What are your thoughts about that?
Yeah. I mean, I can share my thoughts, of course. Just from what I've read, I of course, haven't read a lot. Just kind of a little bit of what was shared, and I did want to read a little bit of his background. I did see kind of his photo that they shared, and of course, of course, he doesn't look like the same guy, but confinement can do that to you. So what I would be interested in is, really knowing what his environment is like, what his confinement looked like, because I can tell you, working in the prison and somebody in confinement, they can develop psychosis. It's just, I mean, anyone would, any one of us would. You're in a black cell 23 out of 24 hours a day, minimal sunlight. There's times where, they have rules in place where you're supposed to take inmates outside for a certain amount of time, to get like fresh air and sunshine. But in reality, the staffing in the prisons are not good. And that does not always happen. A lot of these individuals have no contact with the outside world. They are fed through a 2-inch slot through their door. And so it's not unusual for psychosis to happen. I mean, it's just not unusual. You can get aggressive, violent, psychotic. You don't know what time it is. Your sleep habits change. You may not be able to contact your family. You're falling into a depression. So it isn't. It's just his symptoms that I have seen, the picture that I have seen, it is not completely unusual, from, and it does not mean he's mentally ill.
Right.
It does not mean that he was mentally ill at the time of the crime. He may be developing symptoms at this point because of his environment. And like my husband just kind of blurted out, he himself could be suffering from PTSD because of a crime. And when you are, of course he hasn't been sent or sentenced yet, but when you're living in that type of environment, all you have to do is think about what you have done, and where your life is going. So all of that plays into an individual's psyche that can change your mental, it would change anyone's mental health. Given
Sure.
them.
I appreciate your opinion. That's what kind of, I did want to ask this though. Purdue and I think you and I were discussing this. Purdue is she is a nurse that goes on expert witnesses for jury trials, and we were talking about this a little bit, and now I just lost my train of thought. We were talking about if like say a Richard Allen in that situation would come to the facility, say he was really having psychosis, and he came to your facility. Has anybody ever came in psychosis and they were never ever to be able to restore them back to competency in that situation?
Well, I have not seen it.
Okay.
I have not seen somebody that's never have. No, I can honestly say that no, I've not seen somebody that's never had a mental health condition come to our facility related to psychosis that they developed at in prison and did not regain, did not stabilize.
Okay. That's really important information, and I think that was what the biggest fear for so many people were like, oh gosh, now he's I'm sure he knew what he was doing in the crime because it was all planned out.
Mm-hmm.
So, it wasn't, and then he did what he did to cover up his crime. So he knew what he was doing at the time. At least, well, he planned it. So, or it appears that way. I don't know what happened, but I'm just saying, like, it appears that way from the way things, where he parked and those type of things. But some people were concerned that, oh gosh, if we're treating him this bad in prison, it's going to be our fault, and that now he's not going to be able to go to trial. And, that's kind of what everybody was thinking. Well, not everybody, me and other people. And so that's very reassuring to know that at least you haven't seen it that way. So
I would be surprised, kind of to see, like if they, I would be surprised, like if they took him out of that environment, to see would he stabilize without the use of medications. He could, stabilize with, I don't know if they could ever move him, out of isolation, to see if he would stabilize a little bit, or send him to a state psychiatric facility to see if he would stabilize based on that environment. And might, like I said, he might not necessarily need medications. He might be able to stabilize just being out of that environment. But I'm not saying he should. It just would be interesting, because I can tell you, I will speak from firsthand experience. It is very, seeing confinement and isolation was very eye-opening to me, and seeing what individuals had to do on a daily basis. It's hard because these people have committed a horrific crime, and they deserve to be there because of their crime. But seeing the effects that confinement can have on an individual, it absolutely can change an individual's psyche. And I'm not saying, that they are going to develop any type of mental illness per se, but it does cause, depression and related. It's environmental. It's not a chemical imbalance. It's very much environmental.
And I don't even know if they would be able to put him out of solitary confinement for his own protection.
Mm-hmm.
So I don't.
I don't know all the details of this individual's crime, but it does sound horrific, and it sounds like, quite honestly, just the ages of the individuals. I know most of these, your channel and the individuals that you speak about know, like, prison life. He potentially, killed 2 children, And prison, like the prison talk, does not stand for that type of crime. So yeah, his safety would be a huge concern. So I don't know what that would look like for him. And, you know, the longer that they confine him, the worse his symptoms are going to be. And of course, that will play into all of his being able to, you know, stand trial. And it sounds like his attorneys, you know, are doing a lot of talking because they can't even really get to him much or something. I'm not sure.
Right.
But of course, you know, all of that just because of his environment does not make him mentally ill.
Right. Right. I wonder, did anybody? I was gonna see if there were any questions, and you guys, and you can, Nurse D and Mr. Lou, you can tell me when you're done because they can go. We could go on and on and on and on forever. I don't want you to feel like.
No, please ask any questions if you have anything. I'm by no means an expert. It's just we, you know, we've seen a ton in our years of work, and even in my 8 years at the state hospital, my year in the prison. I mean, I definitely could write a book. I've seen a lot. My, you know, Mr. Lou has seen an absolute ton. I mean, we have seen horrific crimes, and we have seen individuals that are extremely psychotic, extremely mentally ill. We have seen those that, you know, are definitely playing the system, are malingerers. So by no means am I an expert, but we have pretty much seen it all. From anything that you can think of, we have probably seen it or heard about it or have dealt with an individual. So it's very intriguing to us. You know, that's why we do it and continue to work around those that we're very passionate about the mentally ill population. So it does, in types of situations where people fake mental illness, it's very hard on us because that's why there's a stigma around mental illness, and everybody wants to claim, well, they were mentally ill. You know, how can somebody do this horrific act because they were, you know, they have to be mentally ill? Well, no, they don't have to be mentally ill. You know, they're just a terrible person that has done a terrible thing.
Right.
So, you know, we just hands-on experience and being in the environment and seeing what we have seen. So, you know, I'm happy to answer any questions, provide any feedback of whatever you want to ask. So
Let's see. Lynn asked, "Do they continue with meds at jail?" They do, Lynn. I'm not sure if you mean if because there are times where they actually go to the state hospital and then they are released back to jail.
So yeah, unfortunately, so it all depends on, like my husband's or Mr. Lou just said, it depends on the medication. So I can give an example. We have a Seroquel is used in the state hospital a lot as a mood stabilizer. And Seroquel actually is a very abusive drug.
Really?
Yeah, it's very bizarre, and you would never think that. But like he just said, they call it baby heroin where we come from.
Oh my
Because
goodness.
what people do, they will crush the Seroquel and snort it. So if we have and at a therapeutic dose for individuals that need it, it works amazing. But for individuals that are not in need of that type of medication, it does make them high. So the jail will not administer that medication. So we might get an individual that, and so we have to work on with the jails in those types of situations to see if they have the ability to administer a medication. So we do try to ask jails before we send them back if they will and can administer medications. Some do not have medical staff that will administer medications. It's the most bizarre thing, but it happens because we have sent patients back and they have done like a complete 360. They came to us extremely psychotic. We've got them stabilized. It could be a few months. We send them back to jail, and then we find out that they don't have medical staff on staff to administer medications. The individual decompensates within a few days, and they send them right back to the facility. So it happens, unfortunately. But we do try to work with the jails before we send them back to make sure what their capacity is. And sometimes we have to give them an injection, a 30-day injection, before we send them back to jail so that we know that they're medicated while they're in jail. And hopefully they get released. If their charges are light enough, they'll get released from jail. And then we do try to schedule them an appointment with a community mental health center if we know the release date or if they are going to be released from jail.
Okay. I'm still stuck on they don't have people to give meds.
I know.
How do diabetics? What?
Yeah.
I mean, most people take a blood pressure pill or something in their lifetime when they get older. By the age of 40. I mean, I am in shock right now. I thought every jail that's not a requirement to have a doctor and nurse on staff.
I don't know, but it happens. And like I said, we it's not all the jails, it's not all the time, but we are left in shock when we hear that they don't have staff on hand to administer the psych meds. It's usually psych meds for some reason. I don't know if it's because they don't have a psychiatrist that will prescribe the meds and then have nursing staff administer. Usually medical meds they get. It's the psych meds that they don't get.
Wow.
Yeah.
I have to ask some nurses that work in jails if they've experienced that I was really shocked because you would think that that they would want their inmates to be as stable as they could be. You know what I mean? For their own protection. That is bizarre. Really crazy. Okay. Let's see if anybody else said here. I wonder if many people suffer from mental health due to, well, yeah, I would say so, Jinx. Let's see. I have to kind of go through because they were chatting with each other, so I'm trying to go through. And I'm really surprised about Seroquel. They gave me my daughter Seroquel when she was in the hospital the very first time at age 8. That's why I was shocked. And when they gave her that, I don't even know if she's still in here. She had got her homework. This was crazy. I mean, it was too much. I mean, she was like a zombie. And her teacher kept saying, Brittany's not bringing in her homework. I'm like, well, Brittany's done her homework. So we started watching her. I'd watch her walk in the school with her homework in her bag. And by the time she got into the school, she wouldn't have given her teacher her homework. Because like we set up this little thing of where is she not doing her homework. I saw that it's done, put it in the bag, and I watched her walk into the school with her homework in her bag. And she was taking like her homework and just putting it in the trash by the time she got into her classroom. That Seroquel, I mean, she was so young.
Yeah. I've seen Seroquel be, effective, but it can be sedating as well. And it can cause like confusion. And it's definitely not always the first line of medication that's chosen at the hospital, but they do use it. It may not be my favorite to use, but that's why I'm not the doctor.
Right.
But if we do notice, so as the nurse on the unit, if we're with the patients all the time, so if the medications are not effective, or we're seeing like those types of symptoms of confusion, or like just bizarre behavior, or not understanding where this behavior is coming from, we will alert the psychiatrist and say, hey, we might need to look at this medication and see if there's a better one. So um, medications are intriguing, interesting. There's all kinds of different ones that we go through, that we see benefits from.
Oh, I think medication. I mean, and that might be because I'm a nurse, but I'm all about medications. Some people, you know, don't believe in medications, uh,
Right.
and
Yeah.
I am. I
Yeah.
see I mean, I can't imagine. And my channel was actually started for mental health. It just morphed into Delphi, but my channel was started for my daughter and I together. It was actually started with both of us on here, and it was for me as the parent, explaining what it was like having a child with mental illness, and she was coming from the child's point of view for mental illness, and how we navigated the system, and to help other people.
Mm-hmm.
And so that's why when I talk about her, I'm not doing it in a way like, oh, my daughter has this and that. When she came
Mm-hmm.
into the chat, that's because she's part of the channel, and the channel is to help other people. That's what it was started for,
Mm-hmm.
and so I talk about it a lot.
Yeah.
And so does she when she's on here, but obviously I didn't want to have her on here while you guys were on here, so she came in the chat.
Oh.
So, but when one of the things that happened was I was divorced by the time her mental everything started coming out, her symptoms, and her father didn't want her to be medicated, and I did. So that was really, that was a hard thing, because we had to be co-parents, so we wanted to be on the same page. And her psychiatrist finally said, well, you got to decide, do you want her to hurt herself, or do you want her to be safe, and then that's when I think he started getting it. And but people also think that one medication stays the same when you have a child. She would have to go in as she got older, have a psychiatrist, or go inpatient to have a medication change, because her body was changing, her chemistry was changing.
Mm-hmm.
So it's different in children, and I'm sure it's the same with adults. Would you see that you'd have a patient on one medication for a year?
Oh, yeah, absolutely.
Change?
Yeah, absolutely. And dosages change, medications change, one med stops working. It's the complicated way of, unfortunately, mental illness. Medications do work. um, it just sometimes takes many different types of meds, different types of meds, dosages of meds, old school meds, new school meds, constantly medications coming out. So it's just, it's trial and error.
Yeah.
Just, you know, those that, mental illness has such a stigma, and just educating people on the medication and understanding the mechanism of the medication, and why it's helpful, just like, a cardiac medication, or any diabetic medication. It can be extremely helpful, and it aids in allowing people to live their life, and giving them somewhat of a normal. People with mental illness sometimes don't understand that, if you take this medication, you can live a normal life. Or unfortunately, we see the cycle of, they're on this medication, it is helping the voices are gone, their symptoms are better, and they think I'm cured. I don't need any medication. I don't need this medication. I'm all better. Well, guess what? They stop taking the medication and they decompensate very quickly. And, we have to kind of start over. But it's just kind of a cycle. So medications are helpful. I'm all for medications. It can be a frustrating process to get the individual stabilized, and some people have better insight than others. Some people will gain no insight, and those individuals and patients that gain no insight into the mental illness, they're sometimes the hardest to treat, unfortunately. We have loved ones that are pretty, they're severely mentally ill. My father was schizophrenic and an alcoholic. My brother-in-law is paranoid schizophrenic. My sister she was diagnosed actually as schizophrenic at age of 13. And as she progressed, her diagnosis actually changed to bipolar. And that actually happened after pregnancy. They believe just changes in her chemicals. She was no longer experiencing, the hallucinations and visions and hearing things. It very much her behaviors changed to kind of the mood swings, up highs and lows, and so medications do work. My brother-in-law, he is the type, he doesn't have insight into his illness. He does take medications, but his meds definitely need increased, but he won't. And he's on Clozaril, which, we kind of call the king of meds kind of in the psych world, because it's usually used as a last resort of medication.
What was it? I'm not familiar.
It's called Clozaril or clozapine.
Okay, okay.
Mm-hmm.
Actually, Mel just was saying clozapine.
Mm-hmm. It's a very good medication. It's used in individuals that have schizophrenia that is not as resistant to a lot of other medications. He needs an increase, but he is so kind of stuck in his delusions and in his world that he doesn't trust an increase in meds. And we cannot talk, no matter the amount of talking we do and the safety, he will not do it. And it's just his insight, and he is scared to take that increase of meds. And he's a type of individual that's not a danger to himself or others. So we cannot force him to take the medication at this point. So, but my sister, and these are just examples of what we have seen. My sister's bipolar. She's stable and doing very well, and knows when she needs medication. She often goes on and off her meds. But then she'll say, well, I think I need my meds, and then she'll take them, but just various ranges of individuals and medications. And I mean,
and that's one thing about being, well, I'm sure in the state hospital, they have to stay on their well, I guess they don't have to, because we just had that conversation, but they are taking their they know when they're not taking their meds because they're being administered it, your loved ones, they can tell you they're taking their meds, but you don't know they're taking their meds always. So that's another,
right.
That's a whole nother show. Well, I really appreciate you guys coming on, and you have been so insightful for all of us. I can't even tell you. I appreciate both you, Miss Nurse D and Mr. Lou. And you are welcome to come back anytime. You've been so insightful.
Sure.
We'd love to come back.
Absolutely. Anytime. This was so enlightening. We could go on and on about different medication, ECT, everything.
Yeah. Well, it's intriguing, that's for sure. And there's definitely something to always talk about. And it's complicated. It's never going away, but we need more people that want and are willing to learn more about mental illness. I learn every single day, something different. And so it's just, we just need more people to understand it and come together and talk about it. And, just, be supportive. And, I this was about the Richard Allen, some of it was about the Richard Allen case, but just providing insight that, you know, that not everybody that commits a crime is mentally ill. You may develop mentally or psychosis being in confinement, but that also doesn't make you mentally ill. There's true mentally ill people that commit horrific crimes. And yeah, so it's intriguing for sure.
And it's so interesting to learn the process, of what it looks like, from start to finish. It was just it was very insightful, because we don't know. It's not like it's something that's talked about. We don't learn about that except what we see in movies, which isn't real.
Yeah,
So
absolutely. Yeah.
So thank you so much for coming on. It was great.
Sure. You guys have a good night.
Yes. Thank you.
Thank you so much.
Thank you.
Take care.
Bye.
Bye. So what'd you guys think of Nurse D and Mr. Lou? Were you, did you enjoy that? Because I really enjoyed it. I thought they were amazing. I learned a lot. They are really, really good. And I appreciate you guys all staying and listening. But I need to get back to my mental health education. And Mel, are you still here? Because if you are, because we are supposed to be. I love them too, Amy. They're awesome. Mel and we are supposed to do. Oh, thank you, Ray. Thank you, Rose. Mel, we are supposed to be doing a show together on narcissistic abuse. That's one thing that we are supposed to do. And I don't know if you're still here or not. If you are, say hello in the chat. Very informed. Yeah. Mental health is a passion of mine for obvious reasons. I have a love for those that struggle with mental illness, and obviously so does my daughter. She wants to help others that go through it. Yay, Melville is still here. Are you still going to do the show with me on narcissistic abuse? Thank you, Purdue. Yeah, thumbs up. Show some support for Steffa. I'm back to my cheerleading days. Mel and I are going to do a show. Well, we were. I hope she's still okay with it. A show on narcissistic abuse, which is probably everybody in here has had some narcissistic abuse. You just don't even know it. But some of us have actually been true victims, like on a where it affects you. It could be dangerous. So we are going to talk about that one day. We've said that. I don't know if she's still okay with that, but we talked about it probably for like 6 months, a year. But I do want to do more show. I'm back in the groove, back to doing shows again. I will never leave Delphi, because obviously we're all obsessed with getting resolution and justice for Abby and Libby. But I do want to do more shows again on mental health awareness, because that is why I came here in the very, very beginning. So you guys, thank you so much. Texas Girl, Amy, you guys, thank you, Jinx, all the mods. I appreciate you, all of the subscribers. Thank you guys so much for coming. I really appreciate it. I hope you enjoyed it. And I'm sending you love and light and blessings. Oh, before I forget, hold on. Don't leave yet. Let me get the link to Oh, shoot. It's... One second. Okay. Let me go back. Oh, well, let me post. No, it will not. Okay. Let me post it right. Okay. Why isn't it letting me post? Paste. That is Sunny's. I'm going over to Sunny's channel now. I would love you guys to go over there and check out her channel. I think I'm going to go over right now. So you guys are awesome. Thank you again so much for staying. I can't thank you enough. Blessings to all of you. Have a good night.